Okay, Paul Bergamo from NeuroLogic Education. I'm here with Dr. Michelle Boxtel. G'day, Michelle. How are you going?
Hello, good, thanks.
First question for me to you is, how many years have you been in practice?
23, 24, I think.
And where did you graduate from?
RMIT.
Okay, excellent. Now,
Phillip Institute.
oh, back in those days.
Back in those days,
Understand. Now, you're a bit of a groupie. You came to our seminar series last year, didn't you?
Yes, I did.
Okay, and can you tell us how you felt the seminar series has progressed from the dizziness program last year to the next stage with the brain-body connection series this year?
I think it's a very good progression. Last year was excellent in that there was a lot of vestibular-based therapy, based care, a lot of cervical rehab for cervical spine, which put it all together. I used it in practice, very, very good results with it. Patients love it. It gave me something extra in my toolkit that I could use that I didn't really have prior to that.
Okay.
So, and the patients, it really does. It's very successful.
Excellent.
So this is really good as another. What I really like about it is that first you had your evidence-based and then your neuroscience, and I like that you've brought in Dr. Heidi Havoc and Dr. Kelly Holt as well.
Yep.
That's excellent because we need that progression. I really like the stuff they do. It's fantastic, especially their videos for the patients. You can put them up on, your waiting rooms. I email them out and they get them every 8 days.
Yep.
It's just brilliant. Very, very good stuff. And then the practical aspect of it also with Carlo, just adding to that, giving you a little bit more for your toolkit. And the falls risk assessment this morning was very good too.
Look, I love how you use the word toolkit because that's what it's about. Is we have patients of different persuasions, different ages, different presentations, and I think especially with young practitioners, they may come into their careers with just a small toolkit, which is understandable because they're just starting.
Yes.
But someone like yourself who's been around for a long time now would recognise the importance of broadening that toolkit. Is that?
You do, and it just gives you so much more that you can do in your practice rather than just, you can adjust, you can do soft tissue, you can give exercises, but if you can add eye exercises, if you can add balance concepts, if you can add, doing movement with eyes, your laser sort of stuff, it's very good.
Fantastic. So, in light of all that, what are you going to bring in this week? Going from the seminar this weekend to this week, what's the sort of intervention that you thought, okay, I've done this last year, now I'm going to firm up this particular area, or maybe add something a bit novel perhaps? What do you think?
I'll be adding the falls risk, definitely the assessment and the inventory and doing that because we do have a lot of elderly patients. I'm from Tasmania, there's a lot of an elderly population, so that would be excellent to do. And then to be able to do your rehab as well with that, like using those inventories so that then that gives you a tool or a basis to actually then do your rehab. The laser, the cervical rehab was very good too. I'll probably add a little bit more with that as well.
Excellent.
Because you've actually gone a bit further with that too.
Fantastic. Well, thanks, Michelle.
Thank you.
We look forward to catching up with you in our next NeuroLogic Education event.